Welcome back, everyone. We hope you've enjoyed the donuts and snacks graciously provided by Puppet and Sesame Donuts. I would now like to introduce our third speaker, Dr. Rahul Desai. Dr. Rahul Desai began his Portland, Oregon-based pain and interventional clinic, RestorePDX, in 2008. Over the years, the practice has grown, not only in size, but also in scope. His work led to diagnosing and treating in a much more efficient manner. Dr. Desai has explored the boundaries between conventional radiology, interventional pain management, and interventional sports medicine. Let's welcome Dr. Rahul Desai.
So thank you for having me. It's pretty amazing speakers, and following that it's going to be difficult. But what I'll do is kind of a show and tell of my small place in the world of medicine and what we're doing with regenerative medicine. And so I think that for anybody that's interested in technology and medicine, and especially these young thinkers, I think this is very interesting. So based on what I've seen already this morning, think of it as biohacking the body. And so really kind of going outside of our conventional scope of what we're doing. And for you young people, the bad news is we're all getting older, but you got a long way to go. Not some of us, not so much. So we're getting older, and what happens is we degenerate. And what we're going to focus on today is really the musculoskeletal system. So I'm a interventional radiologist. So my background is very allopathic. So I went to college, then medical school. I'm an MD, then did radiology, residency. So for you guys thinking about, I remember when I was younger, how long did you go to school for? My kids asked me that. Asked me yesterday. One of my daughters. So 4 years of college, 4 years of medical school, 1 year of internship, 4 years of radiology residency, and then another year of interventional fellowship. Right? So a lot of schooling, and then 10 years of practice. So I'm very allopathic. I'm a radiologist, pretty much the most black and white type of doctor that you're going to get. I like pictures, and I don't like math. So sorry, I think robotics. When I did my renal rotation, it was all the acid-base disorder. It was very difficult. But I like pictures. So we're going to see a lot of pictures today. The good news about biohacking and health care and everything, we're living longer. And so one of the things that happens is our joints degenerate. Right? We have kind of a limited lifespan. Probably we're meant to live as long as we do these days, and so we're also more active, and it's really good for our heart and muscles and lungs and tissue. But it's rough on the joints, right? The spine, the joint, when we degenerate. So who here has had, especially with the adult population, who's here knee pain, back pain, shoulder pain? Raise your hands. Okay, so pretty much everybody. So we're getting older, the joints are degenerating, and quality of life deteriorates with that. And so there's a number one quality of life issue, and then there's a cost to society because it's expensive to go see the doctors, there's treatments, we have to take time off of work, all those things affect that. Now the current technologies, and what we're talking about, you can look at this drawing, I thought it was kind of cool, but look at, how do we treat things now? You go to the doctor, you have pain, you go and they give you an injection of corticosteroids so the inflammation goes down, it feels better, but it's not doing anything for the tissue. And then when that breaks down, they're doing replacements. Right? So we have joint replacements, heart replacements, stimulators, tissue replacement. So that's kind of the current technology, but it's advancing. And so the good news is, just like a lizard, there's an ability to regenerate. But that hasn't been the standard of care. And there's been a kind of fight, and I'm a little bit of a conspiracy theorist. We have, just like the industrial military complex, right? There's reasons to have guns and weapons, and people want to sell stuff. You can look into that. It's a sad situation, but the same thing is in healthcare. Like there are things that are built, there's mechanisms developed that make money for people, and there's technology that advances, and there's an agenda, and so that's the hard part. With this, what we're going to talk about today is there's an ability for some things to heal yourself, right? But it's hard to monetize. Companies have a hard time making money on it, so it's not pushed. And so that's one of the things to think about. Now there are ways that Procter & Gamble, there's Johnson & Johnson has developed a huge fund for developing regenerative medicine. So they're looking at it, and there will be ways that we're going to advance this. But right now, there's been a bit of pushback. So that's why I want you to think about the young thinkers that go out there, think about these things and novel ways to monetize it, because it needs to come to the public and to our society. So we're talking about regenerative medicine. There's two main fields here. So there's stem cells, and we're going to talk a little bit about that, and there's tissue engineering. Okay? And so tissue engineering, which I do not do, but these are brilliant scientists. This is some work from Wake Forest University, one of the leading edge facilities in the country, but they're actually developing tissue. And so they can do 3D printing with collagen fibers and then implant cells, and they're regenerating kidneys, bones, tissue, and so this is pretty amazing. What we do is a little bit different. We actually take the cells from you, right, and inject them back in. So if someone cuts through, I think when I talk to my patients, one of the easy ways we describe this is that you heal, right? We all heal. So if you cut yourself, you bleed, you have a wound. What happens, the first thing you need to do is hemostasis, right? Stop the bleeding, right? So the cells come into the area, platelets come into the area, and they stick, right? So platelets are bad for the heart, so you take antiplatelet medications, aspirin, those types of things, because we don't want the arteries in the vessels to clot, because then blood doesn't get to the heart, right? And you have heart attacks. The same theory is when you cut yourself, you bleed. Platelets aggregate, and they stick together and they form a thrombin clot. And then when those platelets break down, they release things called alpha granules. They go into the area and they start to regenerate the tissue. And so over time, that heals. And so there's growth factors that are released into the environment, the microenvironment, the climate changes, things happen, and tissue heals. And so that's the natural thing that happens in every part of the body. Unfortunately, there are some areas that don't have good blood supply, like cartilage, like discs, like labrum, meniscus in the knees. And when they get injured, and as we get older, the blood supply diminishes, and they just simply don't heal. They don't have the capacity. So very simple and easy, the whole talk is summarized in this, is that we can go into your body, get those growth factors, concentrate them, and if you're precise and place them into the areas, after diagnosis, you can heal that tissue. So that's what we're going to talk about. So you can see these needles going to different areas. The other thing that's really helped my practice is ultrasound. So now here's the technology that we can guide needles precisely into tissues. And there's no guesswork. We don't have to say, oh, your shoulder hurts, we're going to inject the shoulder area and knock it. We can see exactly why you're hurting. There's sometimes 1 or 2 millimeter areas of injury that we can inject, and we can propagate that healing. And so you can see here, this is a very small 25 gauge, so kind of like an acupuncture type needle. And you can see it's going into the rotator cuff. See how well defined that is? There's no guesswork. That's a millimeter tear that we're injecting. So imagine that you have this powerful technology that you can go into your body, get these growth and healing factors, and then put it wherever you want. There's a really nice combination there. And so for me, about 10 years ago, there was a huge paradigm shift. So I had a lot of patients coming into me, my shoulder hurts, my knee hurts, my back hurts, and I was giving them cortisone injections. And they felt better for about 3 months, and then they would come back and say, I'm still hurting. And what we were doing was simply masking the pain, and the tissue wasn't healing. Right? So the tissue was feeling better, they were using it more, and what happens when they come back? Actually, the tissue is worse than it was before. Right? So then you do that again a few times, the tissue is worse and worse and worse, and then they have to have a surgery. And then the complications with that are pretty immense, especially if you don't have to have that. And so what I want you to think about for today's talk, biohacking, and one of the easy ways to demonstrate this is tendons. So a tendon, who knows what a tendon is here? So what does a tendon do? What's the definition of a tendon? Test. Yeah, so a tendon connects muscle to bone, right? And it's very, very close. So a ligament connects bone to bone. Okay? A tendon connects muscle to bone. And so when a muscle contracts, what does the bone do? Moves, right? And so it moves. So that's what a tendon does. And so what is tendon made of? It's collagen fibers, so type 1 collagen. And so this rope here, those are type 1 collagen fibers. So imagine that this is a healthy tendon. So when you, like you guys, that's what it looks like. For me, not so much. Mine's probably more looking like this over time. And so when you go to the store and buy a brand new rope, it's very tight, taut, collagen type 1 fibers. And as we age, unfortunately, it goes towards the frayed rope. Right? And that's called tendinosis. And so we all suffer from that to some degree or the other. And like we talked about, the more active we are in society, we're working out, rock climbing, all these other things that we're doing, unfortunately the tendons wear out. Where the blood supply is poor, that's where the tendons start to wear. So there's a term called Watershed Zone. We always hear that. I look back and say, what does Watershed Zone mean? And so I look back into the Google, and basically Watershed Zone is a farming term. And we talk about where the water comes in to supply a field. And you have different sources. And where the source is farthest away, that's the watershed zone. So you have one source coming into another source. That crossover zone, there's not a great supply of water. And so the field doesn't grow as well. And the same thing with blood and tissue. The areas that don't get a great blood supply, that's where degeneration happens. And so that's what happens. So there's little micro injuries. And when you're young, you have an awesome blood supply. Like tons of blood, tons of stem cells. You get injured when you're young, you heal pretty quickly. Unfortunately, as we get older, that blood supply diminishes. And where that is, that's where we start to see those injuries. So when you get to your 30s, you start to say, oh, my shoulder hurts, my back hurts. Things start to happen. Why does it happen? It's because our blood supply starts to diminish. And those little micro injuries that you guys heal from when you're young, we don't heal from as well. So this was kind of the sentinel moment for me. So we were doing all these cortisone injections. Patients were not healing. They were feeling great for about 3 months. They were coming back and send them another steroid injection. If it didn't work, then surgery. So a patient came in, and I was very frustrated with this. This wasn't very satisfying as far as a career. So I'm really good at diagnosing why you have pain, because I use imaging, radiology, and I get to examine the patients and talk to them and push on them and prod them. So we're really good at finding out what's going on, but there wasn't good technology to help them get fixed. And so we were looking at things. I heard about this platelet injection, basically going in and getting those growth factors, concentrating them. So not going in and just getting them and injecting blood, but what you do is you go in there and you can concentrate it. So 10, 20 times baseline. So really concentrating platelets. So lots of growth factors, lots of healing potential, and injecting that in. And it sounded interesting. So we had a lot of patients. I had a 250 employee practice that I was working in. This wasn't our current practice. And lots of pain. And so we said, okay, let's try this. It was free. The company gave us a bunch of samples. And we started to concentrate the blood and inject them. So this was a patient that came in. By the end of the day, you're all going to be musculoskeletal radiologists. Okay, so you can put that on your CV. So it's very simple. I'm blessed to do the field, but it's really easy. So if you look at this, do we have a laser pointer, or I'm just wondering if we can, does this come up there? So is there a way that is there something that I can point to? To the screen, yeah. All right, so we talk about the rope analogy. So if you look down here, this is the plantar fascia. So you see this dark band of tissue. That's what a tendon should look like. That's that strong rope that we saw, that was intact. This is an angry rope, right? That frayed rope. And so this should be thin and dark and black like this. And you can see this big gap that's occurring if you look on the screen. So that's a tear. So the patient had extreme pain in their Achilles tendon. So that's an Achilles tendon tear. Not a complete rupture where it comes apart completely, so it's still held intact, but extremely painful. So they came in, and at that time, the standard of care was, I said, you need to go to the surgeon. It's torn, they need to do the surgery and fix it. She had heard that we were doing some platelet injection and said, I don't want to do that. I want to try the platelet therapy. And I said, it's a pretty big tear. We could try. If it fails, it fails. You have to go to surgery. If it works, fantastic. There's not much risk with that. So it's a tiny needle. We saw those acupuncture needles. So this is an example. This is an ultrasound. So that same picture, we can see here that these collagen fibers are here. You see this very linear. That's the good rope. You see these bands going vertically? That's the good rope. So this is the tendon from front to back. And this dark area, that's where the tear is. Okay? So this is that tiny needle that goes in and injects that material in there. So we did the injection, and a few weeks later she came back and said, Doc, I feel amazing. I said, okay, this is crazy. You feel good. This was a total paradigm shift. This is not the normal what should happen, right? They should not feel better, go to surgery. She felt better, but she stayed better. And so then we did another therapy injection. And so this was 4 months interval. And you can see this tear healing. So this is an MRI of the ankle. Right? And you see the white is the tear. Now this is a cross section. So this is looking at the ankle from the side, looking at your Achilles tendon. And this is looking from the top down. So we make slices like that. You can see here, this is the intact tendon. That's the torn tendon. And what's happening here? It's going away, right? You're a musculoskeletal radiologist. That's pretty much, that's the deal. So I was shocked. Like, that was a paradigm shift for me, is that we put this material in there, and it actually is healing the tendon. You can see over that 4-month interval, the pain went away, and that correlated with her. So this is called the American Buddhist. So I like kind of that. So I was running around the practice telling everyone, look at these pictures, this is amazing. And nobody was listening. And so that was a little bit frustrating. But they weren't listening to me in the local level. Nationally, internationally, they started to listen because people didn't have pictures of this. And so part of how I got into the national field, international field, is basically taking pictures. It was curiosity. So that's one thing for you guys. When you're curious about something, when it doesn't fit your path, don't let it go. Like, keep down that path, because it's very interesting. And so for me, it was just a passion. Let's say, this is actually fixing things. So how do you do that? We talked about PRP, or platelet-rich plasma. And so those are getting the platelets and the growth factors. It's basically the fertilizer for your tissue. It's very easy. You go in a vein, you take blood, you spin it down, you get the buffy coat, the platelets, and then you can inject it back in.